3 in the morning. You are lying in bed, and without warning, your calf seizes. Not a gentle cramp, a full contraction that locks the muscle so hard it feels like someone is twisting it with pliers. You grab your leg, try to flex your foot, try to stand, and for 30 to 60 seconds, there is nothing you can do except wait for it to release. By the time it lets go, you are wide awake, your heart is pounding, and you know you are not getting back to sleep for at least an hour. If you are over 60, there is roughly a 70% chance you have experienced this. Nocturnal leg cramps are one of the most common complaints in primary care for adults over 55, and one of the most poorly addressed. Your doctor may have told you to drink more water, eat a banana, or stretch before bed. And if those things worked, you would not be watching this video. Here is what nobody has explained to you. Nighttime leg cramps in seniors are not a hydration problem. They are not a simple potassium deficiency. They are a symptom of something deeper. Your nervous system is losing the ability to properly regulate muscle contraction and relaxation because two specific things are happening simultaneously. Your nerve cells are losing the mineral gatekeeper that prevents them from firing when they should not. And the protective insulation around your nerves, the myelin sheath, is degrading because your body lacks the raw materials to maintain it. The cramp is not the disease, the cramp is the alarm. And the alarm is telling you that your peripheral nervous system needs something it is not getting. What I am about to show you is a specific bedtime drink that addresses both of those problems at the same time. It provides the mineral that regulates nerve excitability, the compound that supports myelin sheath maintenance, and a natural source of melatonin that improves the deep sleep phase during which your body performs the majority of its nerve repair. All in one glass, taken 45 minutes before bed, for less than the cost of a cup of coffee. Hi, I'm Dr. Kevin Miles. I'm an internal medicine physician and longevity researcher. I spent 10 years as a hospitalist in Chicago, watching elderly patients arrive with problems that had been building for decades. Leg cramps were something I saw constantly, and what frustrated me was how dismissively they were treated. A cramp is not just a cramp when it is waking you up 3 or 4 nights a week, destroying your sleep quality, and contributing to the fatigue and cognitive decline that accelerates everything else. Most doctors won't tell you this in a 15-minute visit. I will. Nothing in this video is medical advice. I am sharing published, peer-reviewed research on how specific compounds interact with your nervous system and sleep biology. What you do with this information is between you and your doctor. If this is the kind of real, evidence-based health content you want, hit subscribe. It takes 2 seconds, and it helps this channel reach more people who need it. Now, let me explain what is actually happening in your nerves after 55, because once you understand this, the solution makes perfect sense. Every nerve cell in your body has a gate on it, literally a molecular gate. It is called the NMDA receptor, and its job is to control how much calcium floods into the nerve cell. When the gate is properly regulated, calcium enters in controlled amounts, and the nerve fires precisely when it should. Muscle contracts, muscle relaxes, everything works smoothly. The gatekeeper of that NMDA receptor is magnesium. Magnesium ions sit in the channel of the NMDA receptor and physically block excess calcium from entering. When magnesium levels are adequate, the gate stays controlled. Nerves fire when they are supposed to and stay quiet when they are not. Here is the problem. After 55, magnesium levels in your body drop, steadily, silently, and for multiple reasons happening at once. Your intestinal absorption of magnesium decreases with age. Your kidneys excrete more of it. Many common medications, particularly diuretics, proton pump inhibitors, and certain blood pressure drugs, actively deplete magnesium. And the modern diet, even a reasonably healthy one, provides substantially less magnesium than diets did 50 years ago, because soil depletion has reduced the mineral content of the food supply. Research estimates that between 50 and 80% of Americans over 60 are not meeting the recommended daily intake of magnesium. Not clinically deficient in the way that would show up on a standard blood test, because blood serum magnesium is a terrible indicator of total body magnesium. Less than 1% of your body's magnesium is in your blood. The other 99% is in your bones, muscles, and tissues. You can have perfectly normal blood magnesium and still be profoundly depleted at the cellular level. When magnesium drops below the threshold your NMDA receptors need, those gates lose their gatekeeper. Calcium floods into nerve cells unchecked. The nerves become hyperexcitable. They start firing spontaneously. And what do spontaneously firing motor nerves produce? Muscle cramps. Specifically the kind that wake you up at 3 a.m. because your body is at its most depleted state after hours of not consuming any minerals, and your magnesium-dependent nerve regulation has dropped below the functional threshold. This is not speculation. This is established neuroscience. Magnesium's role as an NMDA receptor antagonist is one of the most well-documented mineral-nerve interactions in the medical literature. Research published in Frontiers in Neuroscience confirmed that magnesium promotes peripheral nerve regeneration, supports the formation of the myelin sheath, the protective insulation that wraps around nerves, and regulates the transmission of neurotransmitters, including serotonin and dopamine. But here is what most people get wrong. They hear magnesium and they grab whatever bottle is cheapest at the pharmacy, magnesium oxide. And magnesium oxide has one of the lowest absorption rates of any magnesium form. Your gut absorbs maybe 4% of it. The rest passes straight through, which is why the primary effect people notice from magnesium oxide is diarrhea, not reduced cramps. The form matters enormously, and it is the reason most clinical trials on magnesium for leg cramps show mixed results. They are using the wrong form. A 2017 study published in JAMA Internal Medicine tested magnesium oxide specifically and found it was not significantly better than placebo. And that study is correct. Magnesium oxide is not significantly better than placebo for leg cramps because you are not absorbing it. The form you want is magnesium glycinate, magnesium bound to the amino acid glycine. This changes everything about how your body processes it. First, the glycine bond dramatically increases intestinal absorption. Your body recognizes glycine as an amino acid and actively transports the magnesium-glycine complex across the gut wall. Second, glycine itself is an inhibitory neurotransmitter. It has its own independent calming effect on the nervous system. So when you take magnesium glycinate, you are getting the magnesium your NMDA receptors need to regulate nerve firing, plus the glycine that independently tells your nervous system to calm down. Two nerve calming mechanisms from a single compound. And third, magnesium glycinate is gentle on the stomach. No diarrhea, no cramping, no digestive distress. This matters because the whole point is that you are taking it every night. If it causes GI problems, you stop taking it. And if you stop taking it, nothing changes. Now, magnesium glycinate alone would make a significant difference for most people with nighttime cramps. But here is where this protocol becomes something more than just a mineral supplement. Because I want to address the second problem, the one nobody talks about, the repair problem. Your nerves do not just need regulation, they need maintenance. And this is the part that connects the cramps to a much bigger picture that most people are not seeing. Every nerve fiber in your body is wrapped in a layer of fatty insulation called the myelin sheath. Myelin is to your nerves what rubber coating is to electrical wiring. It keeps the signal contained, fast, and accurate. When myelin is intact, a nerve impulse travels at full speed. The signal arrives where it needs to go, when it needs to get there, with the right intensity. When myelin degrades, everything goes wrong. The signals slow down, they leak, they misfire, and the symptoms are things that millions of people over 60 experience and attribute to getting old. Tingling in your feet when you stand up, numbness in your fingertips, a burning sensation in your toes at night, reduced grip strength, that feeling like you are walking on pebbles even though the floor is flat. These are not aging, these are peripheral neuropathy. And peripheral neuropathy is, in many cases, a myelin maintenance failure. Now here's the connection that ties everything together. Your body repairs myelin and maintains nerve tissue primarily during deep sleep, specifically during stage 3 and stage 4 non-REM sleep, when growth hormone is released and your body performs the majority of its structural repair work. This is the sleep phase where your brain clears metabolic waste, your immune system recalibrates, and your nervous system performs maintenance on its own wiring. The problem is that most people over 60 are not getting enough deep sleep. Chronic inflammation disrupts sleep architecture. Elevated cortisol from stress keeps you in lighter sleep stages. Blue light exposure suppresses melatonin production. Pain from the cramps themselves wakes you up and prevents you from reaching the deep phases. It is a vicious cycle. Your nerves need deep sleep to repair, but the nerve dysfunction is preventing the deep sleep you need for repair. Breaking that cycle requires addressing sleep quality and nerve support simultaneously. Which brings me to the second component of this drink. This is where tart cherry juice enters the protocol. And the reason is not what most people think. Tart Montmorency cherries are one of the only natural food sources of melatonin. Not synthetic melatonin in a pill. Naturally occurring melatonin bound within a matrix of anthocyanins, polyphenols, and tryptophan that work synergistically to support your body's sleep architecture. A study published in the European Journal of Nutrition gave 20 volunteers either tart cherry juice concentrate or a placebo for 7 days. The cherry juice group showed significantly elevated urinary melatonin levels, increased total sleep time, and improved sleep efficiency. The researchers concluded that tart cherry juice provides an increase in exogenous melatonin that is beneficial in improving sleep duration and quality. A separate study tracked adults over 50 with chronic insomnia. Participants who drank 240 milliliters of tart cherry juice twice daily for 2 weeks saw their total sleep time increase by 84 minutes, an hour and 24 minutes of additional sleep per night from cherry juice. But here is what makes this relevant beyond just sleeping better. Tart cherry juice does not just provide melatonin. It contains anthocyanins, the deep red pigments that give the cherries their color. These anthocyanins inhibit cyclooxygenase 2, the same inflammatory enzyme that ibuprofen and aspirin target. But unlike ibuprofen, which can damage your gut lining with chronic use and has been associated with kidney problems in older adults, the anthocyanins in tart cherry juice achieve inflammation reduction through a food-based pathway that your digestive system is designed to process. Research has shown that tart cherry juice reduces C-reactive protein, one of the primary biomarkers of systemic inflammation. It lowers oxidative stress markers, and it does this while simultaneously providing tryptophan, the amino acid precursor to both serotonin and melatonin, in concentrations that research has shown improve sleep latency and quality even at low doses. This anti-inflammatory effect matters directly for your nerves. Chronic inflammation is one of the primary drivers of myelin degradation. The inflammatory cytokines that circulate through your body when NF-kappa B is chronically activated actually damage the oligodendrocytes and Schwann cells that produce and maintain myelin. Reducing systemic inflammation is not just about feeling less achy. It is about protecting the cellular infrastructure that keeps your nerves functioning. Why does this matter for your nerves? Because nerve repair happens during deep sleep. More deep sleep means more time in the repair phase. More repair time means more myelin maintenance. More myelin means better nerve function. Better nerve function means fewer cramps, less tingling, less numbness, and better muscle control. The magnesium glycinate regulates your nerves right now, tonight, by restoring the gatekeeper to your NMDA receptors. The tart cherry juice improves the deep sleep phase during which your body rebuilds the nerve infrastructure that prevents the problem from recurring tomorrow. One handles the acute symptom, the other supports the long-term repair. Together they address both sides of the equation. Now let me tell you exactly how to make this drink, because the details matter and getting them wrong reduces the benefits significantly. Start with 8 ounces of tart cherry juice. It must be tart cherry, not sweet cherry. Montmorency variety specifically. Look for 100% juice with no added sugar. The sugar-sweetened versions trigger an insulin response before bed that disrupts sleep architecture, which is the opposite of what you want. If the juice is too tart for you straight, dilute it with 4 ounces of water. That is fine. The active compounds are still present. Into that juice, stir 200 to 400 milligrams of magnesium glycinate powder. Start at 200 milligrams for the first week. If you tolerate it well with no digestive issues, increase to 300 milligrams in week 2 and 400 milligrams in week 3. This gradual increase matters. Your liver and kidneys need time to adjust to the increased mineral load. Most people who say magnesium does not work for them either use the wrong form or started too high and quit because of GI discomfort. Add a 1/4 teaspoon of Ceylon cinnamon. This is not just for flavor. Ceylon cinnamon improves insulin sensitivity, which helps keep your blood sugar stable through the night. Blood sugar drops during sleep can trigger cortisol spikes that pull you out of deep sleep. Stable glucose means more uninterrupted time in the repair phase. Use Ceylon, not cassia. Cassia cinnamon contains coumarin at levels that can be problematic with daily consumption. Add a small pinch of sea salt, roughly 1/16 of a teaspoon. Sodium works with magnesium to maintain proper electrolyte balance across nerve cell membranes. Too little sodium at night can actually exacerbate cramping because the sodium-potassium pump that regulates nerve firing depends on adequate sodium. A tiny pinch provides enough to support this without affecting blood pressure. Stir everything together and drink it 45 minutes before you go to bed, not immediately before. The 45-minute window allows the magnesium to begin absorbing and the tryptophan from the cherry juice to begin converting to serotonin and then melatonin in your brain. By the time you lie down, the calming cascade is already underway. And here is a critical addition that most people overlook. Take a B-complex vitamin alongside this drink. B vitamins, particularly B1, B6, and B12, are essential cofactors for nerve health. B12 is directly involved in maintaining the myelin sheath. B6 supports neurotransmitter synthesis. B1 is critical for nerve energy metabolism. Many people over 60 are functionally depleted in one or more B vitamins, particularly B12, because stomach acid production decreases with age, and stomach acid is required for B12 absorption. A B complex taken with your bedtime drink provides the building blocks your nervous system needs to actually perform the repair work that the improved deep sleep makes possible. Think of it this way. The magnesium calms the nerves tonight. The cherry juice creates the deep sleep window for repair. The B vitamins provide the raw materials for that repair to actually happen. Remove any one of these three components and the protocol is incomplete. The magic is in the combination. Now let me talk about what to expect, because if you are thinking this will eliminate your cramps by tomorrow night, I need to reset that expectation. And if I do not, you will quit on day 3. Night 1 through 3. You will almost certainly notice improved sleep quality. The combination of melatonin, tryptophan, glycine, and magnesium produces a noticeably calmer transition into sleep for most people. Falling asleep becomes easier. The 3 a.m. wake-up may or may not improve immediately. Cramp frequency is unlikely to change yet. Week 1 through 2. Sleep consolidation improves. You start spending more time in deeper sleep phases. Some people notice their dreams become more vivid, which is actually a sign of increased REM and deep sleep time. Cramp frequency may begin to decrease, but this is variable. Magnesium tissue levels take time to rebuild. Remember, your body has been depleted for years. 1 week of supplementation does not refill the tank. Week 2 through 4. This is where most people start noticing real changes in cramp frequency and intensity. Cramps that used to happen 4 nights a week may drop to 1 or 2. When they do occur, they are often shorter and less intense. The magnesium is reaching therapeutic tissue levels. The nerve regulation is improving. Morning energy typically improves because sleep quality has improved substantially by this point. Week 4 through 8. Cramp frequency drops significantly for most people. Many report going from nightly cramps to once a week or less. Some report complete resolution. Peripheral nerve symptoms like tingling and numbness, if present, may begin improving as myelin maintenance benefits from the sustained deep sleep improvement. This is the timeline where the repair mechanisms have had enough time and enough raw materials to produce measurable structural changes, beyond 8 weeks. The cumulative effects become your new baseline. Better sleep, fewer cramps, improved nerve function, more energy, better mood, because serotonin synthesis improves when tryptophan intake is consistent and B vitamin cofactors are present. Patients tell me they feel like they have taken 10 years off their nervous system. That is not an exaggeration. That is what happens when you address the root cause instead of just managing the symptom. A few things that will ruin this protocol if you are not careful. Do not use magnesium oxide. I have said this already, but I am saying it again because it is the most common form on the shelf, and it will not work for this purpose. You need magnesium glycinate specifically. Read the label. If it says magnesium oxide anywhere, put it back. Do not use sweet cherry juice. Sweet cherries contain negligible melatonin compared to tart Montmorency cherries. They taste better, which is why people buy them. But they do not provide the sleep-promoting compounds you need. The label should say tart cherry or Montmorency cherry. 100% juice. No added sugar. Do not drink it immediately before lying down and then scroll your phone. Blue light from screens suppresses melatonin production, regardless of how much cherry juice you drank. The 45-minute window before bed should be screen-free. Read a book. Listen to something. Let the melatonin cascade do its job without you sabotaging it. Do not skip the B vitamins. The magnesium and cherry juice create the conditions for nerve repair. The B vitamins are the building materials. Without them, your body has the time and the environment to repair nerves, but lacks the molecular tools to actually do it. It is like sending a construction crew to a job site with no lumber. And do not quit after 4 days. Tissue-level magnesium repletion takes weeks. Myelin repair takes months. Sleep architecture recalibration takes consistent nightly signaling over 2 to 4 weeks. You did not develop this problem in a week, and it will not resolve in a week. The people who get results are the people who make this part of their nightly routine and keep showing up. A note on safety. Magnesium glycinate is extremely well tolerated. However, if you have chronic kidney disease, your kidneys may not clear excess magnesium efficiently. Consult your doctor before supplementing. If you take cardiac medications, particularly calcium channel blockers, Discuss magnesium supplementation with your physician because magnesium can enhance their effect. If you are on blood thinners, check with your doctor as both cherry juice and B vitamins can interact with anticoagulants. Tart cherry juice contains natural sugars. If you are managing diabetes, account for the carbohydrates and monitor your blood glucose. For most people over 55 without these specific conditions, this protocol is among the safest nightly interventions available. I want to leave you with something. When I was working in the hospital, the patients who aged the worst were not the ones with the most dramatic diagnoses. They were the ones who lost their sleep first. Sleep loss cascades into everything: cognitive decline, immune dysfunction, metabolic disease, chronic pain amplification, falls from getting up at night with legs that are numb or cramped, hip fractures from falls, hospital stays from hip fractures. And it starts, for millions of people, with a cramp at 3 a.m. that they learn to accept as normal aging. I watched that cascade play out hundreds of times. A patient would come in after a fall. I would ask when the balance problems started. They would say a couple of years ago. I would ask about their sleep. They would say they had not slept well in years. I would ask why. Leg cramps, tingling, restlessness. And I would think, if someone had addressed the nerve problem and the sleep problem 3 years ago, this person would not be in a hospital bed right now with a broken hip. That is why I am making these videos, because the 15-minute clinic visit will never cover this. And the people who need this information the most are the last ones to find it. It is not normal aging. It is a mineral deficiency, a nerve regulation problem, and a sleep architecture disruption. All three are addressable. All three respond to consistent daily intervention, and the intervention fits in a single glass. Your nerves are not broken. They are waiting for the right signal. One glass, every night, 45 minutes before bed. Give it 4 weeks. Your cramps will tell you whether the research was right. The research is clear. The question is whether you act on it. If this is the kind of content you want, hit subscribe. I am covering metabolic health, cellular longevity, and the science of aging well after 60. Real studies, plain English, no filler. Tell me in the comments whether you have tried magnesium for cramps before and what form you used. I have a feeling most of you will say oxide, and I have a feeling that is why it did not work. After 60, every year you wait costs you more than you think. I will see you in the next one. Dr. Kevin Miles out.